Well, hi, I'm Jay Arthur, author of Lean Six Sigma for Hospitals. We were just out at the Institute for Healthcare Improvement Conference in Orlando, Florida. Like 4,500 medical doctors and nurses and CNOs and CNMOs and people all involved in improving healthcare quality. This is their 31st annual conference. Now, I can tell you, based on what I was looking at on the posters, that people are not really aggressively going after change. But the IHI announced that it's tackling what they call the $1 trillion checkbook. Their goal is to cut healthcare waste by 50% by 2025. That's 5 years from now. Now, guess what? You know, that's a big, hairy, audacious goal. $200 billion would pay for the Affordable Care Act. $300 billion would start to pay down the national debt. Right? Can you say Medicare, boys and girls? So this is a huge opportunity, but we can't go at it the way we've always gone at it. You know, you can't wait a month or 4 months for somebody to get trained as a green belt or black belt and then wait 16 months for a project to finish. No, you've got to start getting results right now, right? You need speed, and you're going to need software to do it. All right, because, you know, the thing is, you don't have to fix everything there is in a hospital. As little as 4%, right? Narrow your focus. 4% of what's going on is producing half the waste in your work. That's why if we just narrow it down with some data and figure out exactly where the 4% is, fix that, we can get that 50% easy. I think we could do it in 24 months if we wanted to instead of 5 years. I think that's kind of delaying it. And my guess is they'll wait until the last year, and then there'll be a huge race to prove that something got better. But here's the deal. I keep finding people out there that are changing the way they're approaching Six Sigma, and they're doing it much the way I've done it for the last 20 years. So here's my book, Agile, Process Innovation, or Hacking Lean and Six Sigma for Maximum Results. This could help hospitals get to zero harm pretty fast. It's a one-day training, 1 day. And then you're going to need QI macro software. And you're going to have to give that to everybody so that they can start to make improvements and do data analysis to find the 4%. You know, I find too many people are out there trying to figure out how to save a few nickels and dimes on software as opposed to trying to maximize the benefit of the improvements that they create with that software. So anyway, this is just my observation. Anyway, I think there's this opportunity to really dramatically reduce unnecessary costs in healthcare. Right? $1 trillion in waste, cut it in half in 5 years, and start paying down lots of debt and things of that nature. Now, you know, a lot of our political candidates out there are saying, let's find some way to tax, you know, the rich or the whatever or something, business or something, to pay for all these social programs we want. Nobody's thinking about how do we reduce the costs that are out there. So if we reduce healthcare costs by 50%, that's going to dramatically improve how much we pay through Medicare and so on. Nobody's talking about how do we reduce the cost of government, because we know at least a third of that is waste. Nobody's talking about that. So anyway, that's my improvement insight for this week. Let's create hassle-free healthcare. Let's create a hassle-free world. Let's go out and improve something this week.